11 years ago, I was engaged to somebody who would tell me how he was going to murder me, and it didn't send a single red flag.
Wasn't like a kink.
I was just, no. I was just like, annoying. But like, I didn't like, it wasn't until years later that I was in therapy that I was like, oh, that was very problematic.
We're saying goodbye to the stigma around mental health with raw, real, and sometimes unconventional topics. Listener discretion is advised.
Hey, welcome back, my muscle proers. So today's guest isn't just in the business of healing. She's in the business of rewriting the rules on what is possible for the human body and the mind. With over half of her patients seeking help with fertility, she's been called the baby maker of South Tampa. She's turned skeptics into believers. She's proof that sometimes the fastest way to heal is also the oldest. So Dr. Ashley has spent over a decade practicing Chinese medicine in Tampa, earning Best of the Bay honors and a reputation for delivering results that feel, well, a little like magic. But what makes her story even more compelling is the road she took to get here, breaking free from cycles of toxic relationships, learning how to hold space for other people in their darkest moments, and discovering the incredible ways our bodies store and release emotional trauma. From the archetype of fertility patient to how an overbearing mother-in-law can literally affect your health, Dr. Ashley brings a perspective that's equal parts ancient wisdom, modern science, and hard-won personal truth. So if you've ever wondered how your story, your mindset, and your body are intertwined, get ready. This is going to change the way you think about healing. Dr. Ashley, welcome to Mind Muscle Pro.
That was the best introduction I've ever had in my life. That was beautiful.
What I'm
Thank
going
you.
for. Wonderful. I just want you to understand you've done some cool shit.
I've been very lucky. Yeah.
No, that's not luck. You've done some cool things. So for one, you've spent over 11 years practicing Chinese medicine in Tampa.
Yes.
You've earned the Best of the Bay awards. That's not luck. That takes work. And even that nickname, the baby maker, that was a South Tampa moms group.
Yeah.
Yeah?
Yeah.
So before all of that, you were in a very different place personally.
Yes.
Can you take us back to that chapter to start, what life looked like then, and how therapy kind of became that turning point?
Sure. Okay. Talk about myself a little bit.
Just real quick.
I mean, something unique, I think, about my upbringing is that my mom conditioned me like a soldier to positive thinking. Like happiness is a choice was drilled into my head. And then any negative emotion was kind of seen as like a personal weakness. Like you can focus on the positive and get yourself like out of any situation. And it worked so well that I found myself over and over again in what most people would consider like toxic relationships or situations where instead of being like, I need to get out, I was like, I need to find a way to be happy here. I need the tools. Like it's a me problem if I can't find happiness here. But I will say, I really was happy. Like whatever my mom did, whatever she did in my subconscious worked because I do feel like I've always been happier than most people I know, even in some really scary, dark situations. Like the silver lining has been very easy for me to find always. But with learning how to always focus on the positive, a lot of emotions get suppressed. And I didn't even realize I was in abusive relationships until I started therapy. I knew something was wrong, but I didn't know what it was. And to get one example, like 11 years ago, I was engaged to somebody who would tell me how he was going to murder me, and it didn't send a single red flag.
Wasn't like a kink.
I was just, no. I was just like, annoying. But like, it wasn't until years later that I was in therapy that I was like, oh, that was very problematic. And so, and I really couldn't see it. And it was, and now in the past 5 years that I've been in therapy regularly, what I'm dealing with is the shame of being in those situations and not protecting myself or taking care of myself. But I really was unaware.
Yeah.
I was just a happy, dumb baby and in dangerous situations. But being out of it now, it's like amazing.
I think you've seen, I'm sure you have because you're just that wonderful, joyous person, the movie Inside Out.
The first one, there's another one, right?
Yes.
Yeah, I've seen the first one.
Your joy was hijacking everything.
Yes, 100%.
Joy took over.
Yes, and I'm still like, is that problematic? But it is if you're with somebody who wants to murder you. That's when it's problematic. But
fear and anger had no place.
Yes, 100%.
That's funny. I can't
And
believe we talked about murdering.
And actually, I forgot now because I'm so healed. But when I initially started the process, I did face a lot of anger that I didn't know was there.
Oh,
And then I had my own murderous fantasies.
Ah!
To get
Then it became a kink.
But yeah.
No, I'm just kidding. That's so funny. No, it's funny, but it's not funny. So how did therapy work into that then?
So my favorite analogy that I always use for therapy is I felt like I was in a dark room that I couldn't navigate, and I would go to therapist and be like, can you tell me where the couch is or where the door is or where this is? And that's how it was. And then I found a therapist who just like turned the lights on. And it took her, and then I was like, oh, I can see everything and I can get out. And I was like, I didn't even know the lights were off. Like, it's so crazy. It's such a crazy experience to realize you're living this way that you don't even see. Yeah. And my therapist is dope. She's also a professional dominatrix. That doesn't come into our sessions, but
I love her.
Helped me so much. And she was very, and like in hindsight, I'm like, how did she do it? She was very patient. Because I had other therapists be like, I think you're in an abusive relationship, or I think this, but I could not see it.
Yeah.
And she kind of like led me to find it myself.
Yeah.
Yeah.
Turn those lights on.
Yeah, turn the lights on.
You didn't need to be told where the couch was.
Right.
You could see the couch.
Yes.
It needed replacing.
Yes.
Yeah, that's cool. We should get her on the show.
She has wild stories. Heather?
We're coming after you. This is just your only warning. No, that's super cool. I think a lot of people listening can kind of relate, having this idea of the environment you're in is normal. And you don't always know that there's something wrong in your environment when that's just how it's always been.
Right.
So those lights, you don't even know the lights were off.
Yeah.
What was it? It was Morticia Adams. What's normal for one isn't normal for the other. For instance, the spider's web is normal for the spider, chaos for the fly.
Yeah.
So I don't know. I think that's fantastic. And in your case, your self-work, how did self-work play into this? So you had your therapist who is super cool. She turned on the lights. What kind of work did you do outside of that for yourself?
I mean, with the lights turned on and then getting to practice setting boundaries with people, changing just how my being is, cutting communication off with people, just how to move in the world in a way that served me more than it served the other people.
Yeah. Protected that joyous part of you a little bit more.
Yeah.
Good.
And just changing my tolerance. Like, my tolerance was so high for bullshit.
Murder.
For real. Like, fucking for real. So crazy now. And then I've done breath work and energy work, and plant medicines, and all of these things have definitely contributed to my awakening. Yeah.
Oh, I love this. No, there's so many different things. I find that when we talk to people, it's very rarely just one thing.
Yes.
It's very rarely just, I went to therapy and I'm awake and now we can move on with life.
Yeah.
It's this integration of now how do I do more in my life outside of the therapy sessions?
It's a whole journey. And I'm so happy therapy is so popular now. Like me, I didn't really come out of the dark until I was 35. And part of me is like, oh shit, like look at all those years I spent in the dark. But then also I'm like, it could have been 60 years. Like, thank God I did it now.
Easily.
And I don't know if young people can even receive help, because sometimes they have to learn on their own. But I tell, like, anytime somebody asks me what's the number one thing I could recommend for their health, and they expect it to be like dietary or supplemental, I'm always like, therapy.
Therapy.
Yeah.
Oh, that's fantastic. I wouldn't think that that would be the number one go-to for a lot of folks. So that's cool to hear. You've talked about, between your bio for this, holding space for patients after devastating life events, from losing a child to getting a terminal diagnosis, without having any formal training in that area.
Right.
You've had to learn how to navigate those.
Yes.
So you went from therapy of your own, lights are turned on, to now in your own practice, in your own career, having to play part role therapist.
Yes.
How did you learn that?
I still don't, I mean, occasionally I play therapist. It's like, it's a tricky balance of what's my scope, what's professional, how can I serve this patient? But under the umbrella of Chinese medicine, they're so black and white about like, oh, well, if they were beaten as a child, then they're gonna have tinnitus and low back problem. And if this happened, so you talk about traumas very matter-of-factly.
Yes.
And so all I'm trained to do is look at your tongue, take your pulses, listen to what you say, and then come up with the point protocol for you. But when somebody comes in and they're like, my child drowned 2 weeks ago, I can't just be like, and show me your tongue, right? There has to be like a way of communication that I felt so underqualified for.
Sure.
When I was a baby acupuncturist, a couple times when I was doing my residency, a patient would come in and tell me something, and I would just sob and have to leave, which doesn't serve the patient at all. I'm just validating. I'm like, oh my God, that's terrible. Like, it's so unhelpful. It rendered me useless. But it's hard to receive those things. And so I learned how the patient is presenting is how I hold space in the room. So if somebody comes in shock, so like the patient whose child died, or I had a patient whose mother committed suicide, and those patients came in, no tears. They just told me like, this just happened. And so I realized not the time to be like, what happened? Oh my God, you poor, right? Then it's like I'm in the ER, it's an emergency. So I'm like, are you eating? Are you sleeping? Like my energy heightens, but it's about the physical well-being. So they understand that something, like I understand that something really serious is going on, but I don't make them talk about it.
Right.
I'm just, how are you sleeping? Let me see your tongue. Do you have any physical pain? Get on the table. And then the points do their job. And that's the witnessing people experience acupuncture in those situations, my reverence for the medicine has gone up so much. I cannot believe what it can do, because it doesn't make sense.
Yeah.
It does not make sense that tiny needles in specific pains, like points, can take somebody out of that space for a little bit. And then if they come in and they're crying, which again, that used to be uncomfortable for me, because I was raised at like, no sadness, no sadness. Oh. So when someone was crying, I was like, but through my own therapy and like working with crying and making noise and screaming and laughing, I'm like, oh, that's the medicine. And acupuncture a lot of the time instigates tears. So like I know certain acupuncture points that I know if I do it, the patient's gonna start crying. And so that's the medicine. So again, my care is on the body, like, okay, this is happening, let's talk about your body. And then I tell them like, your emotion is the medicine, so don't suppress it. So then I'm like cheering them, like if they start crying, I'm like, good, more, go, more. And so it's still a clinical medicinal approach in the emotional approach, but it gave me guidelines, again, how to hold space. And then I realized too, I believe, there's no science to this, that witnessing somebody in their pain increases the medicinal effect. So I see multiple patients at once, but if somebody's really processing and sobbing, if I have the time to just sit there and like just put a hand on them, just so they know I'm witnessing their pain, I think can alchemize it quicker. And these are just tools.
That's so cool.
I think so.
That's kind of cool, because so many people are afraid to show pain.
Yes.
They're afraid to be seen. But you're saying that you have a theory that is actually more beneficial for them to be seen in that moment.
Yes. Have you seen the movie, is it called Midsommar? It's about the cult in the Netherlands.
Movie? Yes.
Horror movie.
Yes.
Did you watch it?
Yes.
Okay, so I don't know if you remember the woman whose whole family died, the young girl.
Yes.
So she's there, she's still traumatized, her boyfriend and his friends, they cannot support her.
No.
She meets this murderous cult, and they mirror her pain. When she's telling the story, they sob with her, and then that heals her, right? And she wants to stay. But it's just the being witnessed and seen made her kill her boyfriend. It was that healing.
We're back to murder. There's a theme.
I ruined the ending to that movie.
No,
but
you did not. You should go see it. If you like horror culty movies, it's good-ish.
I went to an energy healing course in Spain.
Oh, cool.
And they did that there. Like they would
murdered their boyfriends?
They would maybe they would work on you and instigate like an emotion, and then they would sit there and mirror you. So I had this giant tattooed Spanish man sobbing, matching me. It was a wild experience.
Are we back to kinks?
I know. I was like, don't you make me fall in love with you, Spanish. But no.
You tall, dark, handsome, crying man, feeling my feelings with me.
Yes, it was, yes.
That's amazing, though.
Yeah.
How did you come out of that experience?
I thought I was going to learn a modality, like I was going to sit in a classroom and take notes, and they were like, no, you just do the work on yourself the whole time. So I wasn't prepared, but it was incredible. I had to process a lot there. That's actually where I had the experience that I was like, it is not normal for someone to tell you how they're going to murder you. Like I really had to feel it. That was yeah.
So you went thinking you were going to do like a Western class?
Take notes on how to do this energy work,
yes.
yeah.
And they're like, no, sit down.
And they were like, get on the floor.
We're doing the shit now.
Yeah.
Kind of a smack in the face, yeah?
Yeah.
In a cool way. But
yeah, and you could only eat fruit the whole time we were there. I really got to know what hunger was on that trip.
Was that a plant medicine trip as well?
No.
Okay, because they do that with those too.
Yeah, yes, I've done those as well. But those usually you can do like a little bit of beans or a little bit of something. This one was like just fruit because it's energy work, so you had to be like energetically clean. Yeah.
I want to go there, but I think that's a story for another time.
Another time.
I really want to go there
sorry.
selfishly. Okay, cool. So your mission is to give your community the opportunity to experience Chinese medicine.
Yes.
And so for someone who's never had it, what do you wish they understood about how it works and what it can do?
It is a technology beyond my comprehension. I used to feel really confident and used to give PowerPoints on the mechanism of how it works. But the longer I do it, like I said, the more I witness things that I'm like, what is this? Like, how did they do this? And then so I'm just so grateful. I know where to put the points. And if anybody wants to experience the 6,000-year-old practice that is beyond our comprehension, I can like give that to you. So like the mechanism of action. So in Western medicine, how they, like, there is a science in Western medicine on why it works to an extent. Like, it causes your midbrain to dump endorphins into your bloodstream. It activates your parasympathetic nervous system. It gets blood circulation. It decreases inflammation systemically. So all of those things are going to yield a result that's like less pain, more relaxed, better sleep. But there's things in, like in the Chinese explanation of the medicine is so much more convoluted and so much more esoteric. Like, for instance, I'm going to give an example with one of my favorite acupuncture points.
I love it.
Because I feel like it's the best way. So there's a point here, it's called spleen 9. And so if a woman is like late, her period's late, or if she just hasn't had a period in 3 months, or I've even had women who are like, I'm getting married this weekend and I need my period now because I don't want to be on it. This point can like always start a woman's period. 90% of the time. Now, if a woman is, I haven't had my period in months. No, excuse me, that's what I just did. Yeah. If a woman is like, I've been bleeding for 3 months, I can't stop bleeding, you go 4 fingers down to this point, spleen 8, and it stops the period. And it always works. And so I'm like, how, 6,000 years ago, did the Chinese figure out that this point starts your period, or stops your period, and this point stops your period? Like, how? And so their explanation is because in Chinese medicine, the organs all have different functions than they do in Western medicine. So the heart does something different, the spleen does something different, the kidneys than what they would do in Western medicine. And they're connected to these channels. You've seen like an acupuncture doll, like a map?
Yes,
it looks like a subway.
Yes.
And so that subway, they used to just say those are energetic channels, but now they're finding like some connections in the fascia, so we're still trying to understand how it works. But so this point attaches to your spleen, and in Chinese medicine, your spleen controls blood, and it controls energy going up or down. So like if you were having like prolapse, your energy's going down, so you need to work with the spleen to bring it up. And then it also controls the blood. So because these 2 points connect to your spleen, and somehow this one stops and this one starts, but how can you explain that? You know, like you can really reach and be like, well, if the fascia, but how? And so, and anybody who confidently comes on here and they're like, because the chi and the spleen channel, I'm like, no, we don't know. Like I'm totally comfortable being like, I don't know how this works totally. I just know where to put the points.
You've done it enough times without fail that you're confident in it.
I'm confident that I don't know. Yeah, I used to be really confident that I do know, but now I've seen too much.
You've seen too much. You know too much.
I have another crazy one. So if a baby is breech, right, facing the wrong way, there is a Chinese medical treatment I do where I take a stick of mugwort, it's called moxa, it looks like a cigar, smoke it, hold the smoke over the woman's pinky toe, and the baby turns. And it always works. And the women are like, how does this work? And I'm like, I have no freaking idea. I don't know, I just learned it. But the Chinese knew that worked. Out of all the herbs in the world, out of all the places in your body, they were like, right here, baby toe, that herb, turn the baby. How? That's what it's.
I feel like we could go down a rabbit hole of research for the next couple of years.
Just
me and you. And
They did. So Western science has started researching like there's a point on your shin, stomach 36, that's supposed to increase your immune function through your stomach. That's what the Chinese interpretation is. So they studied that when they stimulate that point with a needle, it does increase your white blood cell count. But they still don't know why. And so all the studies about acupuncture, they can prove the outcome. They can be like 90 out of 100 people's headaches were gone, or 90 out of people's knee pain were gone. But the mechanism, they don't really know why, which is why it doesn't get as much credit as maybe it should, because without the why, in Western medicine, nothing exists unless it can be measured.
It's like the math teachers who insist on you showing your work.
Yeah, exactly.
I got the answer.
Right.
Is the answer correct?
Exactly. Why isn't the outcome enough? If why don't the results matter if you don't know why? But
this is fantastic. I'm so intrigued. I know nothing about Chinese medicine.
Oh.
I mean, coming in blank slate, but I love it.
You have to come in and try it.
When and where, sister friend. I'm sold. I'm bringing my husband. So you've said that Chinese medicine mapped the link between emotional trauma and physical health thousands of years ago. You said this earlier, that spanking in children is going to result in
low back pain, addictions, tinnitus, like ringing in the ears, sore knees.
So can you share a few other examples that still shock people when they hear about this?
The mother-in-law one is interesting because in China, mother-in-laws are culturally like the boss, overbearing. And so there was thousands of years ago, the daughter-in-laws would develop like throat issues, like tumors or thyroid issues, because of all the suppression of communication, because you have to respect the mother-in-law, so you have to literally swallow your words, and that stagnates. So then they have all these needle protocols and herbal protocols to help clear. And sometimes it was written, there's an old book that was written, they would just have the mother-in-law come in and watch the daughter-in-law cry for 20 minutes, and that could remedy some of the issues, like just for the understanding.
It's kind of like bringing your abuser in and
right. There's no books about like the mother-in-law changing, but it was just how to. Well, even like for fertility issues, there's a point on your finger that you use for fertility because there's a lot written that suppressing your anger blocks blood flow to the uterus. And again, it's thousands of years old, and I was like, we've been suppressing anger for a long time. And again, there's no writing like, don't suppress your anger. It's like, keep doing it, and here's the acupuncture point that can remedy how that affected your body.
That's fascinating. And, it's hard when we have these talks not to bring it into some level of personal. I don't think I've shared this with my team either. We've been dealing, my husband and I, with infertility privately for, almost 3 years now. And we've just kind of always assumed this is just kind of the lot, and it's okay. He has 3 beautiful children that I now have, and that's enough. But I've accepted that, but people I know with fertility, that's a huge, huge deal. So for them to be able to come and say, maybe there's something in Chinese medicine that can help turn that around, obviously there's no guarantees, or is this another one that it's like, well, 99% out of 100 have seen it work? Is that another one? Because you said half of your patients are fertility seeking.
I never intended for that to happen, and then women started coming in for fertility, and I noticed a pattern. Like all the women were kind of had the same personalities, like same perfectionism, type A, taskmaster, and so I was like, oh, it's just an excess of stress hormones, and so I would have them come in right before ovulation because the Western mechanism of acupuncture is the endorphin dump, and I was like, ride this endorphin dump through your ovulation, because it'll override the stress hormones that are signaling that it's not safe to conceive. And that was working, like women were, I got that reputation because women were seeing me once and getting pregnant. And pregnancy is one of those things where you'll never know if it's causation or correlation. Like if someone comes in with knee pain and they leave without it, I can feel like I did that. With fertility, it's hard to know because there's so many factors at play. Now, there was a study done with IVF where if you did acupuncture in conjunction with IVF, it increased your chances by 45%.
That's massive.
So now, 90% of my patients are IVF. So that's a little different because I don't feel like I'm just supporting their journey. It's not so much as like I feel like I'm correcting. Yeah.
Group
so I'm
effort.
just, it like increases the thickness of your uterine lining, increases blood flow, things like that, which is why it's so helpful. But,
so cool.
Yeah, and there's like, in Chinese medicine, when it comes to and now it's a different world, like microplastics, and I'm not sure how much of our environment is contributing to the fertility that's going on, because the books written on fertility are like they're old before we had all of these factors.
BPA.
One thing that when I was doing my clinical hours, there was a woman there who only treated fertility and with a laser, and she would check the inside of women's legs because all of the meridians that wrap around the uterus run down the inside of the leg, and if there was any scar on the leg, then she would work on the scar because the scar would then be blocking energy and blood flow to the uterus.
She worked with lasers.
Like she had like a little laser like machine.
For acupuncture?
Yes, that would like soften the tissue underneath and soften scar tissue.
Who knew?
That's another thing that Western medicine wouldn't look at, but any scars on the inside of your leg could impede fertility.
Huh.
Yeah.
Huh, that's just wild. All the things
There's
that
a lot of things.
and this has been around for thousands of years.
That's why it's so fun.
It's you're discovering something that feels so new, but it's ancient.
Yeah.
So cool.
It is really
I'm
cool.
going to go home and go down a bunny hole on all this. It's fantastic. Some people call acupuncture pseudoscience.
Yeah. Lots of people.
Yeah.
Yeah.
Even though it's been around.
And anybody who says they haven't done research hasn't done any research themselves, because there is tons of studies that have been done proving its effect. Like I said, maybe not the mechanism of action, but they can prove anti-inflammation, endorphin dump, all of those things, but like specifically like why this point does this.
Yeah.
They can prove that it does, but they don't know why. And so they're like pseudoscience or placebo. But even on Wikipedia, I think they give like Harry Potter more credentials than they do acupuncture. And it's supposed to be that if enough experts write in, they'll change it, and they won't change it, which makes me think conspiracy.
Yes, let's go there.
Yeah. I mean, then why wouldn't they promote an affordable, fast medicine?
You know the answer
I wonder,
to that.
wonder why.
You know the answer to this, because we talk about big pharma here semi-regularly, and some of the conspiracies around great diet, food without a lot of additives to it, getting your exercise, but that America has we have a sick care system, we don't have a health care system.
Yeah.
Whereas in Eastern societies, with all this wonderful knowledge that's been around forever, Chinese medicine, acupuncture, why wouldn't they want all those beautiful things here?
And they're so much more affordable. They can take the cost off the insurance and the tax. Like, why would,
And they're not, I mean, maybe it's addictive, but in a good way. You can get addicted to how you feel after going to a wellness, maybe how you feel after doing acupuncture. How often would somebody need to do acupuncture? I guess it depends on the symptoms they're trying to cure.
It depends. And so I work a little differently than most other acupuncturists. Obviously, for fertility, it's more regimented. Like with fertility, I say at least once a month. If somebody comes in with like I slept wrong and I can't move my neck, that could be like 1 to 3 treatments. But my goal is always one. I'm sure you're familiar with like the idea of treating the root or treating the branch. And so if you everybody wants to treat the root. And so for that, you might be, okay, come in twice a week for 10 weeks. I treat the branch, but that's because I want them to believe in the medicine and like see that it works. Because if I just treat the root, they could, it could take weeks and then they'll get better on their own anyways, and they might not believe in the medicine or trust me. So I've always ran my practice where I'm treating what they want, the symptom, I'm treating to get rid of that fast. So then they trust me, and then they might come in more depending on what they need. Like some people just use me as their primary care. So like if their arm hurts and then a year later they have a cold or something, they'll come in.
I need a new primary care. I like you a lot better than anybody else I've ever met. We'll do that. I don't like. What about people who don't like needles? I'm sure that comes up a lot.
Of course. Like it goes against all of our biological instincts to be like, I'm gonna get stabbed 30 times. Like it's nerve-wracking. And part of me, I wonder if the initial fear is part of the medicine. Whatever chemicals is doing something, and then you realize you're safe. But I always tell people, like, the worst part is before I start. And then once I put a needle in, everyone's like, oh. Like it's nothing. Like my brother, when I was in school, I used to if you were watching TV and really into a movie, I could put a needle in and you wouldn't know. I did it to my brother a couple times. He loved it, but so wrong. But and then I treat I have 10-year-old patients and 9-year-old patients, so I have a gentle hand. Yeah.
Oh, that's fantastic. I got my husband to do acupuncture one time. He's broken his back and he's had neck surgery and he's chronic pain. I mean, the man pops ibuprofen like they're M&Ms.
Is there any? Do you think? Well, is it fertility stuff? talk later.
I don't know. Tell me more. But I got him to do acupuncture. We were on a cruise ship, and he was just in such severe pain. We weren't going to make dock anytime soon. And I was like, can you just try this? I heard it's great. And I heard it doesn't hurt. And I went in with him, and that man was in so much pain during the process.
When they were needling him?
Yes, and they were huge. They were massive. And I was like, I don't think that was it.
So there is different needling strategies. There is. And so I went to a Chinese school, and Chinese seem to be the most aggressive, like the bigger needles, longer needles, more stimulation. The Japanese technique is the idea that like the patient doesn't have to feel much to get the result, and they both work the same. So I was like, why torture the patient if you don't have to? Yeah.
I like
did
that.
Did it help him afterwards? It should.
I don't think.
Then that wasn't it.
It wasn't it. Like
Yeah.
it was aggressive. It was aggressive. So I'd like for him to try it again. I'm not very needle friendly. I'm a little anti-needle, but I've heard enough to have interest. I've heard enough to be intrigued, and I feel like after this conversation, it's enough to warrant. I watched the video that what you did with Nicholas.
Oh, yeah.
And I was like, well, Nick's a big baby, so if he can do it.
I put one right in his face.
I know, I saw that. I was like, go, Nick. So
if I have needles in my purse,
No,
I'll
okay.
put one in you right now.
Oh my gosh. I'd let you. It's for the gram, but you see, like I instantly started
Yeah,
sweating. I was like, oh gosh. Okay, I'm here for it.
No,
Can't
I
you just
won't
look
do
at my
that to
tongue? Like, just let's do the tongue thing. No, I would be open to trying it just because I love the idea of doing something that's been around, been tested. We may not understand it,
Yeah.
but the results are there. I can't stand my mother. God bless her. She gets on me because I won't do flu shots. I never go to a doctor. It's so rare for me because I always feel like I'm just getting a little Band-Aid, or I'm getting something that doesn't really talk to what the issue is. That's going to give me more problems and the side effects than it's worth. So I very rarely ever go to a medical doctor. But I think I would be open to going to something that's not, and I think it stems back from having depression and from having anxiety and from having pills shoved in my face constantly to an unhealthy level as a teenager. And so I think there's a lot of mistrust in the medical world for me from that. So getting over the needle thing would be step one. We'll have to do the tongue thing first, but step one. So you've said that the longer you practice, and we talked about this a little bit, the more you realize you don't fully understand the technology behind the medicine.
Yeah.
So what about it is it that still keeps you curious about it?
I just, in the past couple of years, like I said, my relationship to the medicine, it used to be like I'm doing the medicine.
Yeah.
And now I just feel like I'm just facilitating, and like the medicine is its own entity that I'm just like in reverence of, just because I've seen so many things I can't explain. Like aside from just people getting out of pain, but like I've had some people have some pretty like psychedelic experiences on the table when I put needles in. Sometimes you'll put a needle in and somebody will immediately stop or immediately start laughing. I had a woman throw up immediately. I had to like catch it in a bowl while she had needles in.
Good for you.
But yeah, but I mean like these reactions, right, to like a tiny needle in your arm, and then these huge reactions in your body. And people have said they've communicated with people on the other side when they have the needles in, and I'm not trying to do that. I wish I could control it because I would do that for everybody.
Yeah.
But I feel like so part of the medicine is the physical aspect and putting a patient in homeostasis. Mm-hmm. But there are some ancient books written like about the geometry of the protocols and its connection to the constellations. And sometimes I feel like I'm hooking people up to like a grid. And then something's coming through the grid that is working with the patient that's separate of me. Like they're hooked up and now something else is coming.
Yeah.
And like I said, I've seen it so many times. I had a woman come in, and she was coming in for depression, and she was really shy. And I could tell she didn't even want to tell me she was coming in for depression. Like she had a lot of shame. She was very quiet. And when I came in to take the needles out, she was like, my dead friend came and took me to the bottom of the ocean, and there's people living there. Like she was like, there's people living under the ocean. And that was her experience on the table. I was not trying to do that, but I was just like right on. The next week, a guy came in, didn't know her, had the same experience. Somebody came and showed him the ocean. And I'm like, what is that? So now every week I'm like,
Did you see the ocean?
Yes, I'm waiting. But stuff like that, I cannot. And like occasionally, maybe like once a month, a patient will come back in and they'll have like a wild experience that I cannot explain. You know, they're asking me to explain it. Yeah, it is. That's what I mean. It's so fun. It feels like play every day. I saw on Amy Poehler has a podcast now, and she was interviewing a Broadway star, and they were like making fun of people that say their job is play. Like how like sickening it is to be like, I just play. But that's always what I've said. It feels that way because it's cool.
Why wouldn't you want to?
It's an ancient, it's like.
And you're helping people at the same time.
The first time I discovered it, when I before I even started studying, I went to an acupuncture school because I had an old volleyball injury. They needled me once. I never had the pain again. And I was like, what is this voodoo? Like, that is crazy. I didn't, and I still feel that way.
Yeah.
I had like a couple years where I was really confident and I was like, I understand this. And now I'm back to like, I don't know.
Maybe that's where the New Orleans voodoo dolls come from, is your acupuncture dolls.
Oh, snap.
Maybe there's like some, they came
I
and.
need to research that. I will tell you, when I was studying herbology, you know, some of these herbs, it is like lizard bones mixed with, you know, like this type of plant and this, and I'm like, this is some straight witchcraft. So I went and found like an old Irish like witchcraft book because I wanted to match the formulas, and some of them matched. And also when my ex-fiance, the murderous one, so he was weirded out by the stuff I was getting into. Like he got acupuncture, but then like I was studying like these witchcraft stuff. Or, like,
you're potion making.
I was super into aliens, and he was like really freaked out. But I had hid those potion books, and after I moved out, his mother found them, and he was like, "I got your witchcraft books here." Yeah. But all that to say, there was some similar, you know, I wonder, and part of me too, I suspect like the Salem witch trials, like those women probably were figuring out how to heal people and how to help with fertility. I suspect a lot of it had to do with birth control. Like if they knew natural birth control, then they controlled who had kids, and that's too much power.
Right.
But it's just an understanding of.
And it's just using natural herbs that are here and.
Right.
Yeah.
Like everything we need is already here.
Oh.
And we didn't need a bunch of petroleum-based products to thrive.
We could stay there a minute, couldn't we?
We could. Did you see the song that I wrote on Instagram? Did you?
No, but I've started following you, so I need this song.
Oh.
Do you have a petroleum song?
I wrote a song called "If You're Gonna Do Drugs, Do the Fun Ones," and it was. I don't know if I remember it now, but it's on my Instagram.
I'll find it. You guys, listen. We'll link that exact video in the notes for you, just so you know, along with her Instagram, so you can find her and hear her sing song and get it stuck in your head. I'm here for it. I think that's fantastic. Hearing you talk about, you know, still being in awe after all these years is driving home that healing, you know, it's not a straight line. It's this ongoing journey of discovery, right? And so you're learning new things through your practice. People who are coming to you are learning new things, whether it's their first time doing acupuncture, or maybe it's, you know, they're a regular patient of yours, you're now their primary. For someone listening right now who may be in a dark place and feels stuck, physically, emotionally, or both, what's one simple step or maybe a mindset shift you'd want them to take from this conversation? Loaded.
Yeah. My favorite Taoist saying is, you don't have to know the way knows the way. And so first, to trust that you will be better, you know, instead of being like, this is going to be, you know, like knowing like this is temporary. I will say, in terms of acupuncture, it only takes one treatment to know. So like if somebody was calling me, I'm having severe depression, I would say to them, if you get acupuncture, it takes one time, and you should feel it working. If you don't feel it working, I'm not the practitioner for you, or I didn't choose the right protocol, but it only takes one time.
Yeah.
And then hopefully that would renew their excitement.
That's a lot easier than therapy, because a lot of therapy is you got to come see me 1 hour a week, every week for the next 6 years of your life, versus knowing on one go if acupuncture is going to work.
Sure. And I think it is important to do a lot of therapy as well. But just like if I can change the chemicals in your body so you can even feel hope, then and that will inspire more healing and more healing.
Did you see me almost pass out? That's a thing. You can inspire hope with.
Well, it's if you think about sometimes, right, our feelings create chemicals, and then our chemicals create feelings, and then you're in this wheel. And so if I can affect the chemicals and get you up, and then you can start the cycle in a better direction.
Your spleen stuff.
You remember the spleen? mean, you were a good student. I'm impressed.
Thank you, darling. I pay attention. So, Dr. Ashley, thank you so much for sharing your story and your expertise and your perspective with us. I do think that a lot of people will be leaving this episode with probably a new sense of what's possible for their own healing, right? It may not be, traditional therapy is wonderful and we highly recommend that, but there are other options out there too. So we will link your company. Say it for me.
Wanchi Wellness.
I would have totally messed that up.
It means the energy of play. I know, I love it. But that's just like on my taxes and stuff. Like you just look up my name, Dr. Ashley Heintz, to find me anywhere. But like for my paper.
We came full circle. It's the energy of play, guys.
Yeah.
It's perfect. It's absolutely perfect. We will link that below. She is located in Tampa. So if you are living in the Tampa Bay area, around it, or just visiting, make sure to contact her so that you can get your acupuncture scheduled while you're in town. And then we'll link your social media in the show notes so people can connect with you and do that and learn more. And then for all those listening out there, keep exercising that mind muscle.
I love it. Thank you so much. Super fun.